Well, in the lead up to the speech from the throne, the Liberal cabinet is at a retreat for 2 days, just a stone's throw from 24 Sussex, literally down the street. Today, the focus was on the spiking cases of COVID-19 and if, as the Premier of Ontario, Doug Ford, said today, Canada is headed for a second wave. What will the priorities be in the speech from the throne anyway? Let's find out. Joining me now, the Minister of Intergovernmental Affairs, Dominic LeBlanc. Minister LeBlanc, great to see you. Hope you and yours are well in this. You guys were at your cabinet retreat. I know you were briefed by Dr. Theresa Tam, our Chief Medical Officer, and the Vaccine Immunity Task Force. But while you guys were getting briefed, the Premier of Ontario, Doug Ford, said, we are headed for a second wave. It's not when, it's not if, it's when and how bad it's going to be. Is your government now prepared for Canada to head into a second wave of COVID?
Well, Evan, you're exactly right. The Cabinet spent a great deal of time today listening to public health authorities, listening to experts, scientists, who frankly gave us a portrait of where Canada is now in terms of the cases, what we can perhaps expect in the coming weeks and months, but more importantly, the elements that we need to continue to follow to ensure that Canada is prepared for whatever COVID cases affect Canadians and affect our country. So a great deal of the time, second wave, what are the numbers? That wasn't the context of the discussion. What we said to ourselves and what scientists told the Cabinet was COVID is very much still here. It will be here for a number of months at least. And what can the government do to continue to protect the health of Canadians and also to focus on the very difficult challenge of an economic recovery?
But
so
I just want to...
We took stock of the last number of months, but looked ahead to what we need to do to continue to protect Canadians.
Okay, let me just drill down a bit. Again, Doug Ford, Premier of Ontario, is overtly saying we will get a second wave, that no matter where the curve is crushed, especially in Ontario, it's coming back. Did Dr. Theresa Tam or any of the doctors say, because today's a day where we're seeing spikes, we hadn't seen these spikes in, again, provinces like Ontario for 14 weeks. Other provinces are deeply worried as well, and Quebec very much so. Did the doctors say we're not even close to being out of the woods and a second wave is inevitable?
Evan, I don't think it was framed, as I say, in those terms. What the doctors told us, what the scientists told us, and it's very consistent with what Premier Ford just said. The real public health concern around COVID-19 is still with us. It's not going away in the very short term. It's going to be with us for at least a number of months. Canadians and Canada is much better prepared to deal with the worrisome increase of COVID cases in the last number of weeks than we were obviously in March and April. We learned the lessons from the country and the world getting ready for a pandemic that took a great many people by surprise. Canada is in a very good position now to continue to work with provinces and territories to protect Canadians. That was the discussion we had. And obviously, part of protecting Canadians is ensuring that the economic certainties that Canadians are looking for can be met as well.
Just one last thing on that, if they give you any advice. News today that the biggest producer of a potential vaccine, it's called Serum Institute in India, saying there will not be enough vaccine because they haven't ramped up production, if there is one, till 2024, Minister. Did these doctors, Theresa Tam or any of them, give you any indication of when a vaccine could be ready and when it could be available for all Canadians?
So we did hear from Dr. Tam, but also from the Vaccine Task Force, from scientists that have been working across different governments and academic institutions with partners around the world on the very important issue of vaccines. My colleague, Minister Anand, the minister responsible for procurement, has done a terrific job in terms of setting up contracts with a number of promising vaccine makers to ensure that when there is a vaccine that public health authorities judge is appropriate for Canadians, we'll be in a position to quickly receive a supply to ensure that Canadians can safely be vaccinated. So we took stock of the international context of the vaccine work. We also, Evan, were briefed on the important work being done here in Canada around research, around preparing for vaccines. And it's not only about vaccines, it's about medications and drugs that will help treat people who might get COVID-19. So that discussion was very promising, and I think what Canadians need to know is that we will spare absolutely nothing to ensure that as soon as there's a safe vaccine available, that Canadians have access to it in a very, very expeditious way.
All right. What else? I mean, obviously everyone's wondering about the speech from the throne. There had been all sorts of hints that this was going to be this great opportunity for a big green recovery. I know Chrystia Freeland, the Minister of Finance, met with some banks and they said, whoa, be careful about spending too much. Give us a sense of what possibly we could see there. Is it about recovery in healthcare, or is it about some big green infrastructure spending and we're going to blow through deficits?
So our conversations, Evan, as I said, have focused on the ongoing nature of the COVID-19 pandemic, but also what that means for the Canadian economy, for jobs for Canadians, what that means for businesses that are struggling through these difficult COVID months, what it means for entire sectors of the economy that are obviously going to be amongst the hardest hit. So that's a constant discussion we're having. The speech from the throne, I think, will speak to our government's priorities in terms of the public health emergency, but also the government's priorities in terms of an economic recovery. We learned through COVID-19 in these recent months, Evan, that many communities, many vulnerable populations, whether they're hit economically or in a public health context, deserve better protection. So that's what the government's focused on, and I'm very confident that the throne speech will be positive and inclusive.
Will there be a fiscal anchor? I know the debt to GDP ratio is something your government kept saying. The debt to GDP ratio is about 35%. It's probably now closer to 50% and going up. What is the fiscal anchor? What is the thing that the public can hold your government to account on the deficit? What is it going to be now?
Well, Evan, the Minister of Finance in the coming weeks will have a lot more to say about the government's priorities in terms of both the fiscal context, but in terms of investing to ensure that the recovery is real and protects Canadians at a time when they need their government to very much be there in their corner. So, Evan, we have said from the beginning that the government will do what it takes to ensure that Canadians are protected, and that includes doing what it takes to ensure that we have a sustained, long-term economic recovery that doesn't leave sectors of the economy, vulnerable populations or regions of the country behind. Those are the discussions we had, and the Minister of Finance and the Prime Minister will obviously be talking more about that in the coming weeks. And
the provinces will want money for healthcare. They'll want money, even though education is also their jurisdiction. They want it from the federal government. So do municipalities. So your job's going to be busy. Just before I let you go, I know you were very close with the Chrétiens, and we all mourn the passing of Aline Chrétien, who I know you know very well. Have you heard from Mr. Chrétien and any words about someone who was both tough, graceful, and a very noble woman?
Evan, I'm glad you asked the question. I had the privilege literally to know Madame Chrétien and Mr. Chrétien for probably over 3 decades. He gave me my first job when I finished law school and my articling. So I had a chance to get to know a remarkable woman, somebody who was eternally gracious, generous, highly motivating for the young assistants that worked with the Prime Minister in those early years in the 1990s. It's a very, very tough loss for the Chrétien family. I saw Madame Chrétien probably 1.5 years ago. Her health had declined, but I could see the very special relationship that she and Mr. Chrétien had for over 6 decades. So certainly our hearts and our thoughts are with Mr. Chrétien and France and Hubert and Michel and the entire Chrétien family. It's a very, very big loss.
Yeah, I appreciate that. Rest in peace to a wonderful woman. Dominic LeBlanc, I really appreciate that. We're looking at your province. They've got a big election today, the first COVID campaign. We'll watch that closely. Thank you, sir.
I already voted, Evan. Even if I'm in Ottawa tonight, I already voted.
Mail-in ballots. We'll talk about that as well. Thanks, Dominic LeBlanc.